I'm just going to give a little bit of an overview about anticoagulation, about clots. So why do we anticoagulate? We can anticoagulate either to treat a clot that you currently have or to prevent future clots. So there are some times where we treat a clot and then we stop the blood thinner. And there's other times where we treat a clot, and if there's something that is in a person's blood that puts them at higher risk for a clot, or we're worried about some type of a risk factor that remains in place, then we will keep them on a blood thinner long term. Okay. So different types of clots. You can get a clot in your lung called a pulmonary emboli. You can get a clot in any kind of vein. It's called a deep vein thrombosis. You can also get superficial clots in veins that are not deep, not bigger veins that are deeper in the extremities. You can have a stroke, so a clot in the brain, or you can have a heart attack. So you can get them in veins, you can get them in arteries. There's something called atrial fibrillation. Have you guys heard of that? So in your heart, you have the top two chambers, those are your atrium. You have the bottom parts, those are your ventricles. At the top part, the atrium, instead of pumping like this, they kind of quiver. Then you can get a little bit of a blood that pools in something inside that one of the chambers of the heart. And then when it goes back into a regular rhythm, as it usually happens, it can kick that out into the body. So if a person has atrial fibrillation, that is something else that would lead them to being potentially on a blood thinner. So signs and symptoms to look for. You probably know these well, right? We talk about them every visit, okay? So one of the things would be if you're going to get a clot in a leg, you could have redness, you could have swelling, you could have warmth or pain. You could have one of those symptoms, you could have all of those symptoms. So it just depends on the person. But a lot of times, if you've had a clot before, you'll usually experience similar symptoms the next time you have a clot. So you always want to think about, what did it seem like before and what am I having now? So let's say a pulmonary embolism, it would usually be chest pain, it'd be shortness of breath. Sometimes people have back pain with it, okay? Sometimes people have very different symptoms, and that's why I say think about what it was before if you're thinking, could I be having another clot? Stroke symptoms, we think about weakness on one side of the body, facial droop, difficulty finding words, garbled speech, and then heart attack, chest pain. A lot of times it would be left arm pain, sometimes chest pressure. So anytime a person's had a clot, we tell you about these symptoms, not to scare you, because I know when you hear them, you're like, oh gosh, am I going to have another clot, right? But we tell them so that you can teach other people. Whenever a person has a clot, we always say, educate your family, right? And the first time you hear it, you're just kind of like, I'm scared. I don't want to think about having another clot. But then the more you hear it, it helps you to be able to say, you know what? It's empowering. Knowledge really is power, right? So you're less likely to have some type of a bad outcome with whatever's going on in your life if you know more about it and you can prevent it. Okay, so there are a lot of anticoagulants. And if you were to watch TV, you are going to see other things advertised on TV than just these, okay? These are the ones that we use because we have found that these have the safest, they're the safest, and they're the most effective, okay? So Xarelto, the other name for it is rivaroxaban, and Eliquis, the other name for it is apixaban. These are the direct oral anticoagulants. We try to use these whenever we can. If we are unable to use it, we use Coumadin, or warfarin is the other name for it, and I will go into the differences between those two. Lovenox is something we use more like during pregnancy. That is an injection, okay? We use it at other times. If a person has a clot while they're on a blood thinner, then we will usually use Lovenox for 2 weeks to a month, and then we'll transition them onto a different blood thinner usually. Lovenox, if a person is on a blood thinner, such as a direct oral anticoagulant or warfarin, okay, we don't usually use those during pregnancy. Now, there are times where we will use warfarin, okay, but only certain trimesters of pregnancy will we use it. And that's usually if a person has like a heart valve that is artificial. But there are some times where we'll use Lovenox throughout as well, okay? So Lovenox, it depends on the person, like what they have going on. If they've never had a clot, but they have risk for a clot, or if they've had a lot of miscarriages before, and that's why they're on it, they would just get a once-a-day dose, and it's usually 40 milligrams, okay, a preventative dose. If a person's had a clot before, and I'm really talking generalization here, if they've had a clot before, then, and especially if it's at the time of a pregnancy, okay, or around the time of a pregnancy, or with hormone-provoked clot, such as a blood thinner, such as an oral contraceptive pill, then we would usually use Lovenox full dose, okay? So we would use it twice a day, usually. Now, different clinics sometimes do it a different way, but we generally use it twice a day and full dose preventative therapeutic dosing for something like that. But like I said, each person's a little different. So I always tell people, like, you don't want to go ask your friend or your aunt or uncle what they had for a blood thinner necessarily, because their story, their health history is going to be different than yours. So, all right. And then Arixtra or Fondaparinux is another injection medication, and it is a once a day medication that we sometimes utilize. Lovenox is not something that we want to use long term with people, because it can cause your bone density, a bone density issue. And so generally, if we have to use an injection and we can't use the direct oral anticoagulants or Coumadin, then we would use Arixtra. Okay, it is a good blood thinner. And then occasionally we'll add antiplatelet medications such as aspirin and Plavix. Plavix, the other name for that is clopidogrel. So sometimes we'll add those in addition to the blood thinners if a person's had a clot on a blood thinner, or sometimes they end up with them if they've had arterial clots, so clots in their arteries. Warfarin is something that's been around since the 1950s, okay? So that is the medication that if your grandparents were on warfarin or were on a blood thinner, it was probably warfarin, okay? And even 10 years ago, most people were on warfarin. I would say 10, 15 years ago, most people were on warfarin if they were on a blood thinner. We started really using the direct oral anticoagulants like Eliquis and Xarelto have been out longer than that, but we really started using them more around that time period. So the advantages of warfarin are that they're cheap. You can check an INR, so that tells you the blood thinness. It's very easy. You can do it with the finger prick, or you can do it by drawing out of the vein. And some people even have those machines at home. So it makes it very easy to check them, okay? They can be influenced, the warfarin can be influenced by food and medication both, okay? So you can have whatever you want to eat, but if it has a lot of vitamin K and there's a lot of fluctuation in your diet, then a lot of times you'll see that INR, the blood thinness, change, okay? The direct oral anticoagulants, there isn't any food restrictions. We don't have issues with that. We don't have to worry about the food. I mean, we don't say you can't eat it, like I said, but we just say you have to be, you have to watch it, okay, and be consistent. The issues with Eliquis and Xarelto are that they can be expensive. Most commercial insurances, you can get a $10 copay card and it's just going to cost you $10 a month. But when people get to Medicare age currently, it can be a little more cost prohibitive. So with Eliquis and Xarelto, we usually check kidney function. BMP is how we check a kidney function, and then a CBC. So we're looking at the blood count. We usually do that once a year in somebody that has normal blood counts and normal kidney function. Now, for some reason, a person has low blood count or they have a kidney function that's not quite normal, then we'll check it more frequently. It doesn't hurt your kidneys, the Eliquis and the Xarelto, but it is cleared partially through your kidneys. And then we can check a level called an anti-10A, but it is something that we have to send out and wait for it to come back. It's not quite as easy as an INR, but we don't usually need to check them very often anyway. Okay, there's only certain situations where we check them, and it's not often. And then there's also fewer medication interactions with Xarelto and Eliquis. Some of the seizure medicines can influence it, so sometimes we will not use them with seizure patients. Not always. There are times where we do when we check these levels called anti-10A. Okay, but definitely there's times where we say, you're on these medications, we can't utilize this, we need to utilize warfarin, okay, or a different medication altogether. Okay, so therapeutic versus prophylactic dose direct oral anticoagulants. So that just means, are we treating a clot? That would be therapeutic. Or are we preventing a clot? That would be prophylactic. Okay, so a lower dose versus a higher dose. So factors to consider. Time since the last clot. It depends on the type of clot you have, on how long we're going to keep you on the higher dose of a direct oral anticoagulant like Xarelto or Eliquis. And then the kidney function. If a person has kidney function that isn't quite normal, we might have them on the lower dose. So kidney function, age, and body weight, the combination of those three, if two of the three of them meet a certain requirement, then we would consider decreasing the dose. Additional risk factors, if a person has a family history of clots, then sometimes we will check different things in the blood, and depending on what it shows, that might make us keep them on the higher dose of the blood thinner versus decreasing that dose. Smoking, a lot of times I will keep the dose higher if a person smokes because that increases the risk a lot as well for an additional clot. Being overweight, high blood pressure, diabetes, high cholesterol, family history, or having a clot while on a blood thinner, that's also going to make us keep the blood thinner at the same dose. All right, so signs and symptoms to call with. Any type of bleeding symptoms, okay? So having heavy periods, blood in the stool, coughing up blood, vomiting up blood. I mean, those things sound concerning, right? So those are automatic calls to us, okay? Any kind of symptoms of a clot, all the things that we went through earlier. We tell you guys those things when you come in for an appointment, but the thing is like, that's a lot of stuff that we just told you, right? Can you memorize that stuff? We don't expect you to. We just say, if there's something concerning and you think, could this be a clot, just call us. We'll help you figure it out. Changes in medication. So if a person's on a blood thinner, we want to know any changes in medication. Like I said, with the direct oral anticoagulants, we don't usually have any issues with interactions, but certainly you can. And so we usually just say, call us with any changes and we'll let you know if there's an issue. Illnesses doesn't usually affect Eliquis and Xarelto unless you can't take it because you're vomiting, right? But with warfarin or Coumadin, it can influence it. And so we usually just say, call us with any illnesses and we'll let you know if you need to do anything different. Injuries and procedures. So if anybody wants to cut on you and you're on a blood thinner, we need you to call. If anybody wants to cut on you and you're not on a blood thinner, we want you to call because should we put you on a blood thinner after is the question. If you have any kind of injuries that are going to lay you up and you have a history of a clot, then we need to be thinking, should we put you on a blood thinner while you're healing? Because just the fact that you're not as mobile, you're not walking around as much, that can put you at increased risk for a clot. So we're all about prevention, okay? So if you've had a clot and you're not on a blood thinner, we want to make it so that you're not having to go on one long-term, because once you end up with a second clot, it's usually long-term blood thinner unless you're having bleeding symptoms. So we want to do everything we can to prevent long-term blood thinner if we can help it. So anytime that you think, there's this is going on, should I be on a blood thinner to prevent? Definitely call. Definitely pregnancy. If you've had a prior clot, we should at least be considering a blood thinner at that point, and that would be the Lovenox injections.